Frozen shoulder, also known as adhesive capsulitis, is a condition characterized by stiffness, pain, and limited range of motion in the shoulder joint. It typically develops gradually and can severely impact daily activities. The exact cause of frozen shoulder is not always clear, but several factors may contribute to its development. Immobilization. Prolonged shoulder immobilization due to surgery, injury, or a prolonged period of rest can lead to frozen shoulder. Medical conditions. Certain conditions can increase the risk, including diabetes, thyroid disorders, cardiovascular disease, and Parkinson's disease. Age and gender. It most commonly affects people between the ages of 40 and 60 and is more common in women. Other risk factors. Previous shoulder injuries, repetitive shoulder strain, or inflammatory conditions like rheumatoid arthritis can also be contributing factors. Symptoms. Frozen shoulder typically progresses through 3 stages. Freezing stage, painful stage. Pain, gradual onset of shoulder pain, often worsening at night or with movement. Stiffness, increasing difficulty with shoulder movement, leading to a reduced range of motion. Frozen stage, adhesive stage. Severe stiffness, significant loss of shoulder mobility. Pain may lessen but stiffness persists. Reduced function, difficulty performing daily activities that involve shoulder movement. Fine stage, recovery stage. Gradual improvement, range of motion begins to improve, and pain decreases. Recovery, full range of motion and function may return over time, though recovery can be slow. Diagnosis. Diagnosing frozen shoulder involves medical history, discussion of symptoms, their progression, and any relevant medical history. Physical examination, assessment of shoulder pain, range of motion, and functional limitations. Imaging studies, X-rays, to rule out other conditions like arthritis or fractures. MRI can help to visualize the shoulder joint and identify inflammation or other issues. Treatment aims to relieve pain, restore shoulder mobility, and improve function. Medications. Pain relievers, over-the-counter options like acetaminophen or ibuprofen can help manage pain and inflammation. Corticosteroid injections, administered directly into the shoulder joint to reduce inflammation and pain. Physical therapy, stretching and strengthening exercises, to improve range of motion and shoulder function. Manual therapy, techniques used by physical therapists to help restore movement and reduce stiffness. Heat and cold therapy. Heat, applying warm compresses can help ease muscle tension and pain. Cold, ice packs can reduce inflammation and numb pain. Home exercises. Regularly performing prescribed exercises at home to maintain and improve shoulder mobility. Surgical options rarely needed. Shoulder manipulation, performed under anesthesia to gently move the shoulder and break up adhesions. Arthroscopic surgery, to remove scar tissue and adhesions from the shoulder joint. Prevention. While frozen shoulder can be challenging to prevent, the following strategies may reduce risk. Regular shoulder use. Engage in regular shoulder movements to avoid prolonged immobility. Manage underlying conditions. Address and manage any medical conditions that could increase the risk of frozen shoulder. Early treatment. Seek prompt treatment for shoulder injuries or conditions to prevent complications and stiffness. Prognosis. Recovery time. The condition often improves over time, though full recovery can take several months to years. Functionality. Most people experience significant improvement in shoulder function and pain relief with appropriate treatment. Conclusion. Frozen shoulder is a condition that causes pain, stiffness, and limited range of motion in the shoulder joint. Although it can be quite debilitating, with appropriate treatment including physical therapy, medications, and sometimes surgical interventions, most people recover significant shoulder function. Early intervention and adherence to treatment plans are key to managing symptoms and improving outcomes. If you suspect you have frozen shoulder or are experiencing persistent shoulder pain and stiffness, consult a healthcare provider for a thorough evaluation and personalized treatment plan.